Intra-articular injection is a new treatment method that is commonly used for patients suffering from inflammatory complications. This method is used to improve and treat various diseases such as arthritis, rheumatism, bursitis, gout, and knee arthrosis. In this method, medicine and anti-inflammatory substances are injected directly into the patient's joint with a syringe. Today, this method is also used to relieve pain and improve inflammation in various joints of the body such as the knee, in addition to prescribing painkillers and anti-inflammatory drugs, and performing physical therapy. In this article, we will talk about intra-articular injection, its types, benefits, application. Please stay with us until the end. Intra-articular injection is a non-surgical treatment in which steroids and other anesthetic solutions are injected directly into the damaged joint tissues. This method is used if inflammation and joint pains do not improve after taking drugs and other treatment methods such as physiotherapy. In fact, this type of injection improves the performance of your range of motion and makes exercises like physiotherapy easier for you. This treatment method can be used in joints such as knees, shoulders, wrists, hips, and other cases. Although this method is not considered a permanent solution to eliminate joint pain, but it can reduce joint pain for a long time. One of the best methods used to treat joint pain, especially arthritis treatment, is joint injection. Usually in this injection, a medicinal substance is injected into the joint to relieve pain and inflammation. There are different types of intra-articular injections, which we will discuss further. Scene script. Cortisone is an anti-inflammatory compound that has many uses in medicine. Usually corticosteroid injections are used in joints for people who have musculoskeletal disease. Note that long-term use of cortisone leads to complications such as high blood pressure, osteoporosis, and diabetes. But short-term use of Cortin under the supervision of a specialist doctor brings good therapeutic results for joint pains. In the joint, there is a substance called synovial which plays an effective role in joint function. In patients with arthritis, the synovial material is significantly reduced, which leads to pain, inflammation, body dryness, and limited movement. For this reason, by injecting hyaluronic gel in the joint, these side effects can be prevented to a large extent. The number of hyaluronic acid injections for patients varies according to the expert doctor's opinion. Platelets are one of the most important factors that play an effective role in body growth. For joint PRP injection, they first take some of the patient's blood, then separate its platelets by centrifugation. In PRP injection, these platelets are an important source for cell growth. Some evidence shows that injecting ozone gas into the joint helps repair damaged tissues. However, accurate scientific evidence that can prove this claim has not yet been provided. Body stem cells are cells that can become different body tissues such as bone, cartilage, skin, and liver. Since injecting in this way may have side effects, it is not recommended for this reason.
For whom is joint injection useful? People who suffer from diseases such as rheumatoid arthritis, joint inflammation, psoriatic arthritis, tendinitis, gout, bursitis, carpal tunnel inflammation, osteoarthritis, etc., can use joint injections to reduce inflammation and relieve their pain. The low invasiveness of joint injection is one of its most important advantages, which relieves and reduces joint pain without the need for surgery. Some injections, such as PRP injection and placental injection, have more advantages, because they do not contain any steroids and they use natural materials such as stem cells and blood platelets to reduce pain and inflammation. PRP is a concentration of your own platelets, which are chock full of growth factors. Injected into an injured joint, these growth factors kickstart the body's natural healing process, reducing inflammation and promoting tissue regeneration. Also, with this type of injection, doctors can check whether the pain caused by inflammation is related to the joints or if it has another cause. After the injection, as the synovial inflammation decreases, joint pains also decrease. Although joint injection ampule is not considered a permanent method to reduce pain and definitive treatment of rheumatism and arthritis, but it can relieve joint pains and reduce inflammation for up to 6 months. Side effects of joint injections are usually mild. The most common side effects are heat and pain in the injection area, joint pain and stiffness, or movement problems. If it does not improve and the pain increases, be sure to see a doctor. Some other side effects of joint injections are bleeding, itching, blistering, coldness, burning, numbness, skin discoloration, tingling, scarring, pressure, and hives. Some patients may experience side effects such as pain and swelling when injecting steroid, as the fluid accumulates in the joints. And if it does not resolve within 2 days, you should definitely see a doctor. In summary, one of the best and most effective methods used today to treat joint inflammation and injury is joint injection. Intra-articular injection is a low-risk method with many benefits that helps to treat many disorders such as arthritis, and it usually takes half an hour to an hour for examination and recovery. This procedure is done with X-ray imaging, and special drugs are given through IV to keep the patient calm before the injection. It's essential to remember that, like all medical procedures, post-injection care is crucial. Following the injection, it's advisable to avoid strenuous activities for at least 48 hours and to apply ice to the injection site to manage any potential swelling. So what about aftercare at home? It's a breeze. Rest, ice, compression, and elevation. Remember that as rice. Also, resist the urge to take anti-inflammatory drugs. They might hinder the healing process. After all, life's too short to be held back by knee pain.